going back into the history a little bit, if you go back and see, we used to amputate all limbs before, so that what we were planning was complete eradication of the tumor locally. But now the technology in the last, let us say, 25, 30 years has caught up. We have improvements in metallurgy, we have improvements in surgical skills, we have various other modalities which have helped us out. And also our experience in doing joint replacements. Joint replacements started around 50 years ago, and we have been gaining a lot of experience with that. So what we're able to do now is remove the tumor in such a manner that there is no spillage of cells when you're operating. So what we basically do is we operate and remove the tumor with a small cuff of normal tissue, so that you don't even see the tumor at all when you're operating, and you remove that in total. When you're able to remove that, we can reconstruct the gap which is there in terms of muscle or bone with either a muscle transfer. In terms of a bone, we replace it with an artificial prosthesis. So instead of amputating, what you're doing is removing the tumor and replacing or reconstructing it with whatever you have, and the patient is then having his or her own limb in an original manner. They're able to walk, they're able to move their limb, we even get a joint in place, so they're able to move their joints. So that is what we call limb saving. We are not removing the limb, we are keeping the limb. It's called limb saving or limb sparing surgery.
Subscribe to our channel and press the bell icon for more videos on cancer care.